Canadians did not report excellent or very good health, but alarmingly, that figure rose to 50% for First Nations people living off reserve. Chronic conditions including high blood pressure, arthritis, asthma, mood disorders, and diabetes affect almost 2/3 of off-reserve First Nations people. So, to the Premier, when will Indigenous Albertans enjoy levels of health and wellness that are comparable to Albertans in the general population?
The Minister of Indigenous Relations.
Thank you, Mr. Speaker, and thank you very much for, I think, is an excellent question, because it really reveals the fact that the government of this province and the government of Canada has failed to address the issues of the Indigenous community for, well, essentially 100 years in this province. And we have finally come along to address some of the structural issues that are causing these problems, and we are doing so not only on reserve but off reserve by increasing child tax credits, by having school programs, and by working very closely with the First Nations communities to make true differences in their communities.
First supplemental.
Given that the same study found that off-reserve First Nations females were significantly more likely than males to report having one or more chronic conditions, and given that poor health outcomes are linked to smoking and completion of high school education, unemployment, low household income, and other unmet health needs, to the Minister, what is the government doing, please be specific for Albertans, sir, to strengthen Alberta's non-profit agencies that provide support for women to address these very factors?
Honourable Minister.
Thank you, Mr. Speaker, and thank you very much for the question. I want to identify that we've done a number of things specifically for women in the Indigenous community. This year, for the very first time, we gave core funding to the Institute for the Advancement of Aboriginal Women, something that's never done by the previous government. We've also increased the amount of money being given to the Friendship Centres, which work with the women, and we've been working across the board in every one of our ministries to institute the United Nations Declaration on the Rights of Indigenous People to ensure that there are changes in our curriculum, in our health programs, and in our employment programs, all of which change the structural indicators.
Thank you, Honourable Minister. Second supplemental.
Given that the Child and Youth Advocate recommends making mental health programs more accessible in First Nations communities, and given that the Advocate also recommends Alberta Mental Health Services incorporate cultural components in treatment strategies for young people, and that Human Services, Education and Health require professionals to have adequate training about the history of Indigenous peoples, to the Minister of Advanced Education, sir, what steps are you taking to ensure that educational opportunities to achieve these competencies are available to Alberta's current and future professionals?
Honourable Minister.
Well, thank you, Mr. Speaker, and of course we continue to support the work of advanced education by providing predictable, sustainable funding, which we've done in 2 consecutive budgets with 2% increases each year. And of course we continue to make sure that all Albertans have opportunities to achieve high-quality, affordable education by keeping tuition costs low through a 3rd year of a tuition freeze. Mr. Speaker, we continue to work with the presidents of the universities and colleges to look at the issues of access for all Albertans, particularly rural and Indigenous people of this province, and we continue to find ways to improve the system.
Thank you, Honourable Minister.